Which medication, if prescribed for the client with glaucoma, should the nurse question? 1. Butoxolol 2, pilocarpine 3, erythromycin 4, atropine sulfate. Answer 4. Atropine sulfate. Rationale. Options 1 and 2 are miotic agents used to treat glaucoma. Option 3 is an anti-infective medication used to treat bacterial conjunctivitis. Atropine sulfate is a mydriatic encycloplegic, also anticholinergic medication, and its use is contraindicated in clients with glaucoma. Mydriatic medications dilate the pupil and can cause an increase in intraocular pressure in the eye. A client is receiving heparin sodium by continuous intravenous IV infusion. The nurse should notify the healthcare provider if ongoing nursing assessment reveals which finding? 1. Tinnitus 2. Ecchymosis 3. Increased pulse rate 4. Increased blood pressure. Answer 2. Ecchymosis rational. The client who receives a continuous IV infusion of heparin is at risk for bleeding. The nurse assesses for signs of bleeding, which include bleeding from the gums, ecchymosis on the skin, clotty or pink-tinged urine, tarry stools, and body fluids that test positive for occult blood. The other options are not side or adverse effects related to this medication. A physical has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? A. Naproxen sodium, naproxen. B. Calcium carbonate. C. Clarithromycin, Bioxin. D. Furosemide, Lasix. Answer A. Naproxen sodium, naproxen. Rational. Naproxen sodium is a non-steroidal anti-inflammatory drug that can cause inflammation of the upper GI tract. For this reason, it is contraindicated in a patient with gastritis. Calcium carbonate is used as an antacid for the relief of indigestion and is not contraindicated. Clarithromycin is an antibacterial often used for the treatment of Helicobacter pylori in gastritis. Furosemide is a loop diuretic and is contraindicated in a patient with gastritis. The nurse teaches the wife of a client who is receiving levodopa, carbidopa to avoid pyridoxine medications. Which statement by the wife indicates an understanding of the instructions? 1. Vitamin B6 will change perspiration and urine to a dark color, which may stain clothing. 2. Vitamin B6 reverses the effectiveness of the medication, meaning a higher dose is needed. 3. The medication competes with vitamin B6 for absorption in the intestine, blocking absorption. 4. The two medications in combination will cause the blood sugar to drop, causing hypoglycemia. Answer 2. Vitamin B6 reverses the effectiveness of the medication, meaning a higher dose is needed. Rationale: pyridoxine. Vitamin B6 reverses the therapeutic effects of levodopa. Dietary restrictions are not necessary, but ingredients of multivitamins should be assessed. Many multivitamins contain pyridoxine and should be avoided. Careful reading of over-the-counter vitamin labeling is necessary to avoid increasing pyridoxine in the diet. The statements in the remaining options are incorrect. A primary healthcare provider prescribes cisplatin and vincristine to a client with bladder cancer. The nurse should explain to the client that two medications are administered together for which reason? 1. To prevent alopecia. 2. To decrease the destruction of cells. 3. To increase the therapeutic response. 4. To prevent gastrointestinal side effects. Answer 3. To increase the therapeutic response. Rationale: cisplatin is an alkylating type of medication and vincristine is a vinca plant alkaloid. Alkylating medications are cell cycle not specific. Vinca-alkaloids are cell cycle specific and act on the M phase. Combinations of medications are used to enhance tumoricidal effects and increase the therapeutic response. Alopecia and gastrointestinal disturbances are sign adverse effects of chemotherapy. A client is being discharged to home with enoxaparin for short-term therapy. What should the nurse explain to the family about the medication action? 1. Relieves joint pain. 2. Dissolves urinary calculi. 3. Stops progression of multiple sclerosis. 4. Reduces the risk of deep vein thrombosis. Answer 4. Reduces the risk of deep vein thrombosis. Rationale: enoxaparin is an anticoagulant that is administered to prevent deep vein thrombosis and thromboembolism in clients at risk. It is not used to treat the conditions listed in options 1, 2, or 3. The nurse hangs a 1,000 ml intravenous IV bag of 5% dextrose in water, D5W, at 0700. The IV solution is to infuse at 80 milliliters per hour. At 1200, how much solution will be left to infuse? Fill in the blank. Answer: 600 milliliters. Rationale: if a 1000 ml IV bag is to run at 80 milliliters per hour, the first step is to determine the amount that has infused between 0700 and 1200. Multiply the number of hours by the rate of the infusion. Step 1 to 5 hour times 80 milliliters per hour equals 400 milliliters. Step 2. The next step is to determine the amount of ml that needs to be infused in the remaining amount of time. 1000 milliliters minus 400 milliliters equals 600 milliliters. Dantrolene sodium is prescribed for the client experiencing flexor spasms. The client asks the nurse how the medication is going to help. The nurse replies that this medication acts in which way? 1. Depresses the spinal reflexes, causing the spasms. 2. Acts on the central nervous system to suppress spasms. 3. Acts directly on the skeletal muscle to relieve the spasms. 4. Acts within the spinal cord to suppress excess reflex activity. Answer 3. Acts directly on the skeletal muscle to relieve the spasms. Rationale: dantrolene sodium acts directly on skeletal muscle to relieve muscle spasticity. The primary action is the suppression of calcium released from the sarcoplasmic reticulum. This in turn decreases the ability of the skeletal muscle to contract. The other options are incorrect actions. The primary health care provider, PHCP, prescribes fat emulsion given intravenously for a client. The nurse should consult with the PHCP before administering the fat emulsion solution if which is noted in the client record. 1. The client has an allergy to iodine. 2. The client has an allergy to egg yolks. 3. The client is receiving total parenteral nutrition. 4. The client has a blood glucose level of 120 milligrams per deciliter, 6.9 mmol/L. Answer 2. The client has an allergy to egg yolks. Rationale: before administering any medication, the nurse must assess for allergy or hypersensitivity to substances used in producing the medication. Fat emulsions may contain an emulsifying agent obtained from egg yolks. Clients sensitive to eggs are at risk for developing hypersensitivity reactions. Options 1, 3, and 4 are not contraindications to the administration of fat emulsions. A primary health care provider, PHCP, prescribes quinidine gluconate for a client. The nurse decides to withhold the medication and contact the PHCP if which assessment finding is documented in the client's medical record. 1. Muscle weakness. 2. History of asthma. 3. Presence of infection. 4. Complete atrioventricular AV block. Answer. 4. Complete atrioventricular AV block. Rationale. Quinidine gluconate is an antiarrhythmic medication used to maintain normal sinus rhythm after conversion of atrial fibrillation or atrial flutter. It is contraindicated in complete AV block, intraventricular conduction defects, and abnormal impulses and rhythms caused by escape mechanisms, and with myasthenia gravis. It is used with caution in clients with pre-existing muscle weakness, asthma, infection with fever, and hepatic or renal insufficiency. The home care nurse is visiting a client who sustained a severe muscle sprain to the back. Carbidopa is prescribed for the client. The nurse provides instructions to the client regarding the medication and should teach the client to take which measure. 1. To avoid driving until the reaction to the medication is known. 2. To understand that muscle spasms will be reduced but the pain may increase. 3. To limit alcohol consumption to 2 drinks daily while taking the medication. 4. To try to avoid missing doses, but if a dose is missed, to take it as soon as it is remembered. Answer. 1. To avoid driving until the reaction to the medication is known. Rationale. Carbidopa, a centrally acting skeletal muscle relaxant, may cause central nervous system (CNS) side effects of drowsiness and dizziness. For this reason, the client avoids other CNS depressants, such as alcohol, while taking this medication. Driving or other activities requiring mental alertness also should be avoided until the client's reaction to the medication is known. The medication is used to reduce muscle spasticity and pain. Missed doses should be taken, if remembered, within 1 hour. The nurse has a prescription to give a first dose of hydrochlorothiazide to an assigned client. The nurse would question the prescription if the client has a history of allergy to which item. 1. Iodine. 2. Shellfish. 3. Penicillin. 4. Sulfa medications. Answer. 4. Sulfa medications. Rationale. Thiazide diuretics, such as hydrochlorothiazide, are sulfa-based medications, and a client with a sulfa allergy is at risk for an allergic reaction. A sulfa allergy must be communicated to the pharmacist, primary healthcare providers, PHCPs, and nurse. The other options are not contraindications for administering the medication. Lisinopril has been prescribed for a client with hypertension. What should the nurse instruct the client about this medication? 1. Take the medication with food only. 2. Discontinue the medication if nausea occurs. 3. Rise slowly from a reclining to a sitting position. 4. Expect to note a full therapeutic effect immediately. Answer. 3. Rise slowly from a reclining to a sitting position. Rationale. Lisinopril is an angiotensin-converting enzyme inhibitor used in the treatment of hypertension. The client should be instructed to rise slowly from a reclining to a sitting position and to dangle the legs from the bed for a few moments before standing to reduce the hypotensive effect. It is not necessary to take the medication with food. If nausea occurs, the client should drink a non-cola carbonated beverage and eat salted crackers or dry toast. A full therapeutic effect may be achieved in 1 to 2 weeks. A client is scheduled for discharge and will be taking phenobarbital for an extended period. The nurse would place highest priority on teaching the client which point that directly relates to client safety. 1. Take the medication only with meals. 2. Take the medication at the same time each day. 3. Use a dose container to help prevent missed doses. 4. Avoid drinking alcohol while taking this medication. Answer. 4. Avoid drinking alcohol while taking this medication. Rationale: phenobarbital is an anticonvulsant and hypnotic agent. The client should avoid taking any other central nervous system depressant such as alcohol while taking this medication. The medication may be given without regard to meals. Taking the medication at the same time each day enhances compliance and maintains more stable blood levels of the medication. Using a dose container or pill box may be helpful for some clients. A client has a prescription to receive valproic acid daily. To ensure the client's safety, when is the best time for the nurse to schedule the administration of this medication? 1. At bedtime. 2. Mid-afternoon. 3. 2 hours after lunch. 4. 2 hours before breakfast. Answer: 1. At bedtime. Rationale: valproic acid is an anticonvulsant that causes central nervous system (CNS) depression. For this reason, the side effects include sedation, dizziness, ataxia, and confusion. When the client is taking this medication as a single daily dose, administering it at bedtime negates the risk of injury from sedation and enhances client safety. The medication also should be administered at the same time each day. The nurse is monitoring the laboratory results of a client receiving an antineoplastic medication by the intravenous route. The nurse plans to initiate bleeding precautions if which laboratory result is noted. 1. A clotting time of 10 minutes. 2. An ammonia level of 10 mcg per deciliter, 6 mcmol L. 3. A platelet count of 50,000 cubic millimeters, 50 times 109 per liter. 4. A white blood cell count of 5,000 cubic millimeters, 5.0 times 109 per liter. Answer: 3. A platelet count of 50,000 cubic millimeters, 50 times 109 per liter. Rationale: bleeding precautions need to be initiated when the platelet count decreases. The normal platelet count is 150,000 to 450,000 cubic millimeters, 150 to 400 times 109 per liter. When the platelet count decreases, the client is at risk for bleeding. The normal white blood cell count is 5,000 to 10,000 cubic millimeters, 5.0 to 10.0 times 109 per liter. When the white blood cell count drops, neutropenic precautions need to be implemented. The normal clotting time is 8 to 15 minutes. The normal ammonia value is 10 to 80 mcg per deciliter, 6 to 47 mcmol L. The nurse is preparing the morning medications to be administered to assigned clients and is reviewing the primary health care provider's prescriptions. Which medication prescription should the nurse question? 1. Lenoxin 0.25 mg orally daily. 2. Hydrochlorothiazide orally twice daily. 3. Docusate sodium 100 mg orally twice daily. 4. Enoxaparin sodium 20 mg subcutaneously daily. Answer: 2. Hydrochlorothiazide orally twice daily. Rationale: the prescription for the hydrochlorothiazide is incomplete because the dosage is missing. The prescriptions in the other options are complete prescriptions. The nurse is monitoring the laboratory values of the child with leukemia who is receiving chemotherapy. The nurse prepares to implement bleeding precautions if the child becomes thrombocytopenic and the platelet count is less than how many cells per cubic millimeter? 1. 200,000 cubic millimeters, 200 times 109 per liter. 2. 180,000 cubic millimeters, 180 times 109 per liter. 3. 160,000 cubic millimeters, 160 times 109 per liter. 4. 150,000 cubic millimeters, 150 times 109 per liter. Answer: 4. 150,000 cubic millimeters, 150 times 109 per liter. Rationale: if a child is thrombocytopenic, precautions need to be taken because of the increased risk of bleeding. The precautions include limiting activity that could result in head injury, using soft toothbrushes, checking urine and stools for blood, and administering stool softeners to prevent straining with constipation. Additionally, suppositories and rectal temperatures are avoided. The normal platelet count ranges from 150,000 to 400,000 cubic millimeters, 150 to 400 times 109 per liter. The nurse who is caring for a client with myasthenia gravis has a prescription to perform an edrophonium test. After obtaining edrophonium, the nurse should be certain that which also is available at the bedside. 1. Atropine sulfate. 2. Protamine sulfate. 3. Calcium gluconate. 4. Magnesium sulfate. Answer: 1. Atropine sulfate. Rationale: an edrophonium test is performed to distinguish between myasthenic and cholinergic crisis. After administration of the edrophonium, if symptoms intensify, the crisis is cholinergic, because the symptoms of cholinergic crisis will worsen with the administration of edrophonium. Atropine sulfate should be available because it is the antidote. Protamine sulfate is the antidote for heparin. Calcium gluconate is the antidote for magnesium sulfate toxicity. A client with gastrointestinal hypermotility has a prescription to receive atropine sulfate. The nurse should withhold the medication and question the prescription if the client has a history of which disease process? 1. Biliary colic. 2. Sinus bradycardia. 3. Peptic ulcer disease. 4. Narrow angle glaucoma. Answer: 4. Narrow angle glaucoma. Rationale: atropine sulfate can cause a blockade of muscarinic receptors on the iris sphincter, producing mydriasis, dilation of the pupils. It also produces cycloplegia, relaxation of the ciliary muscles. It is contraindicated in clients with narrow angle glaucoma. The other options are therapeutic reasons for using the medication. The nurse is caring for a client with a history of heart failure just diagnosed with type 2 diabetes mellitus. The primary healthcare provider prescribes an oral hypoglycemic for the client. Which oral hypoglycemic medication prescribed for this client should the nurse question? 1. Acarbose. 2. Glyburide. 3. Ripaglinide. 4. Pioglitazone. Answer: 4. Pioglitazone. Rationale: an adverse effect of pioglitazone is heart failure secondary to renal retention of fluid. For most clients, fluid retention is not clinically significant. However, for clients with heart failure, especially severe or uncompensated heart failure, increased fluid retention can make heart failure worse. Accordingly, pioglitazone should be used with caution in clients with mild heart failure and should be avoided by those with severe failure. Thus, option 4 is the correct option. Options 1, 2, and 3 do not have any side effects and adverse effects related to heart failure. A client is receiving heparin sodium by continuous intravenous IV infusion. The nurse should notify the primary healthcare provider if ongoing nursing assessment reveals which finding. 1. Tinnitus. 2. Echinomosis. 3. Increased pulse rate. 4. Increased blood pressure. Answer: 2. Echinomosis. Rationale: the client who receives a continuous IV infusion of heparin sodium is at risk for bleeding. The nurse assesses for signs, symptoms of bleeding, which include bleeding from the gums, ecchymosis on the skin, cloudy or pink-tinged urine, tarry stools, and body fluids that test positive for occult blood. The other options are not side or adverse effects related to this medication. A client diagnosed with anxiety is starting therapy with lorazepam. Which factor in the client's history should prompt the nurse to consult with the primary healthcare provider before administering the medication? 1. Hypothyroidism. 2. Diabetes mellitus. 3. Narrow-angle glaucoma. 4. Coronary artery disease. Answer 3. Narrow-angle glaucoma. Rationale: lorazepam is a benzodiazepine and is contraindicated in hypersensitivity, cross-sensitivity with other benzodiazepines, comatose state, pre-existing central nervous system depression, uncontrolled severe pain, and narrow-angle glaucoma because these medications can further increase the intraocular pressure. It also is contraindicated in pregnancy and in women who are breastfeeding. None of the other options are relevant to the administration of lorazepam. A client who has undergone renal transplantation is receiving ongoing therapy with cyclosporin. The nurse would be sure to immediately report which abnormal finding: 1. Decreased creatinine level. 2. Decreased hemoglobin level. 3. Decreased white blood cell (WBC) count. 4. Elevated blood urea nitrogen 1 level. Answer 4. Elevated blood urea nitrogen 1 level. Rationale: cyclosporin is an immunosuppressant. The use of cyclosporin can cause nephrotoxicity. This complication is detected by assessing for elevated levels of BUN and serum creatinine. Decreased hemoglobin level and WBC count are incorrect because cyclosporin does not depress the bone marrow. A client admitted to the hospital is taking zidopioidine. The nurse monitors the client for which adverse effect of the medication: 1. Colitis. 2. Ototoxicity. 3. Neurotoxicity. 4. Visual disturbances. Answer 3. Neurotoxicity. Rationale: human immunodeficiency virus (HIV) can cause acquired immunodeficiency syndrome, which is a viral disease that destroys T cells, thereby increasing susceptibility to infection and malignancy. Zidopioidine is a nucleoside reverse transcriptase inhibitor that is used in combination with other antiretroviral agents to treat human immunodeficiency virus (HIV) infections. Adverse effects include anemia, granulocytopenia, and neurotoxicity as evidenced by ataxia, fatigue, lethargy, and nystagmus. Can also occur. Colitis, ototoxicity, and visual disturbances are not adverse effects of this medication. The nurse notes that a client with schizophrenia and receiving an antipsychotic medication is moving her mouth, protruding her tongue, and grimacing as she watches television. The nurse determines that the client is experiencing which medication complication? 1. Parkinsonism. 2. Tardive dyskinesia. 3. Hypertensive crisis. 4. Neuroleptic malignant syndrome. Answer 2. Tardive dyskinesia. Rationale: tardive dyskinesia is a reaction that can occur from antipsychotic medication. It is characterized by uncontrollable involuntary movements of the body and extremities, particularly the tongue. Parkinsonism is characterized by tremors, mask-like facies, rigidity, and a shuffling gait. Hypertensive crisis can occur from the use of monoamine oxidase inhibitors and is characterized by hypertension, occipital headache radiating frontally, neck stiffness and soreness, nausea, and vomiting. Neuroleptic malignant syndrome is a potentially fatal syndrome that may occur at any time during therapy with neuroleptic antipsychotic medications. It is characterized by dyspnea or tachypnea, tachycardia or irregular pulse rate, fever, blood pressure changes, increased sweating, loss of bladder control, and skeletal muscle rigidity. A client with depression receiving phenylzine sulfate suddenly complains of a severe headache and neck stiffness and soreness and then begins to vomit. the nurse takes the client's blood pressure and notes that it is 210/100 of a millimeter Hg. On the basis of the findings, the nurse should obtain which medication from the emergency drawer of the medication cart? 1. Phentolamine. 2. Protamine sulfate. 3. Calcium gluconate. 4. Phenobarbital sodium. Answer 1. Phentolamine. Rationale. The antidote for hypertensive crisis is phentolamine. Hypertensive crisis may be manifested by hypertension, occipital headache radiating frontally, neck stiffness and soreness, nausea, vomiting, sweating, fever and chills, clammy skin, dilated pupils, and palpitations. Tachycardia or bradycardia and constricting chest pain also may be present. A nurse has provided discharge instructions to a client being placed on long-term anticoagulant therapy with warfarin sodium. Adequate learning would be evident if the client makes which statements? Select all that apply. 1. I may take over-the-counter medications as needed. 2. I will inform my dentist that I am taking this medication. 3. I should alternate the timing of my daily dose of this medication. 4. I should use a firm bristled toothbrush to prevent the side effects of this medication. 5. I will have my blood levels checked as prescribed by my primary health care provider, PHCP. 6. I will report any signs of blood in my urine or stool to my primary health care provider, PHCP. Answer 2. I will inform my dentist that I am taking this medication. 5. I will have my blood levels checked as prescribed by my primary health care provider, PHCP. 6. I will report any signs of blood in my urine or stool to my primary health care provider, PHCP. Rationale: cardiovascular. Anticoagulant clients need to notify all primary health care providers, PHCPs, that they are on warfarin sodium therapy. Dental procedures may put the client at risk for increased bleeding, so this should direct you to option 2. Knowing that the effectiveness of warfarin sodium is based on maintaining a therapeutic blood level will direct you to select option 5. Awareness of bleeding as a primary complication will direct you to option 6. A client has a prescription for valproic acid. To maximize the client's safety, the nurse should plan to monitor for which potential complications of this medication? Select all that apply. 1. Pancreatitis. 2. Hypotension. 3. Renal failure. 4. Hepatotoxicity. 5. Cardiotoxicity. Answer 1. Pancreatitis. 4. Hepatotoxicity. Rationale: valproic acid is an anticonvulsant that causes central nervous system depression. Although rare, this medication has caused pancreatitis and hepatotoxicity. The nurse should monitor for these complications. The other complications noted in the options are not specifically associated with this medication. What actions should the nurse take when caring for a client having an anaphylactic medication reaction? Select all that apply. 1. Assess vital signs. 2. Administer oxygen. 3. Ensure a patent airway. 4. Contact the primary health care provider, PHCP. 5. Continue the medication but monitor closely and note the reaction in the chart. Answer 1. Assess vital signs. 2. Administer oxygen. 3. Ensure a patent airway. 4. Contact the primary health care provider, PHCP. Rationale: if anaphylaxis occurs, the nurse immediately assesses the client's respiratory status. The medication is also immediately stopped. If the client's airway needs to be established or stabilized, the rapid response team is called. In addition, the PHCP is contacted. The intravenous IV line is not removed because IV access is needed to administer emergency medications such as diphenhydramine or epinephrine. The client is positioned appropriately. The legs and feet are elevated. The head of the bed is elevated to improve ventilation. Elevate the head of the bed 10 degrees if hypotension is present and 45 degrees or higher if the blood pressure is normal. The nurse stays with the client and monitors the client's status, including the vital signs. The nurse documents the event, actions taken, and the client response.